Greetings, this is Craig Paulson. I'm sitting with Dr. Gruessner, the surgeon that created the cancer and the transplant programs at UAMC here in Tucson, Arizona. He has been suspended by UAMC for some considerable time now. I'm sitting with him and I have some very important questions, pointed questions really, to address to him. Welcome, Dr. Gruessner.
Glad to be here.
Tell me about your vision for the Department of Surgery at UAMC.
Well, I came to the University of Arizona in 2007 and I took over a department that was pretty much in shambles. The entire Department of Surgery had to be rebuilt. We had to build new divisions and we had to bring in new faculty from all over the country. The goal was to build a nationally known Department of Surgery that is recognized in as many surgical fields as possible so that the citizens of Tucson, Southern Arizona, and Arizona would not have to seek medical and surgical treatment outside of the state anymore, as it had happened in the past, that Tucson residents had to travel to Phoenix, to San Diego, to Los Angeles, or to San Francisco. It was a daunting task at the time, but with the support of the then president, the then dean, the then hospital CEO, and so forth, it was accomplished by an entire team of surgeons and myself. And we were very proud of what was accomplished. And this was all evidenced by the successful management of all the trauma victims of the unfortunate Tucson shooting just a few years back when Congresswoman Giffords and many of her supporters were a target of a vicious shooting attempt. 11 patients were subsequently treated at UAMC. All of them left the hospital within a short period of time, and a good number of them probably would not have survived what had happened if it hadn't been for the fact that we had an excellent trauma center by then, re-established, rebuilt, and were able to treat the patients accordingly. So we took a lot of pride, and when I say we, my team and I personally took a lot of pride in what happened, what was accomplished, and I think we were really on the right path of building something that Tucson never had, great surgical treatment for all of its citizens.
What are the reasons the former dean's hostility against you, and why was he retaliating against you?
Well, I think it's a relatively long story. When I came, there was also a search for a chair of the Department of Medicine. However, the institution did not have the money to conduct two national searches, and the then CEO of the hospital and others put basically 85% of their support behind the Department of Surgery. And they appointed someone internally from the Department of Medicine to be the chair of medicine, and that was Dr. Goldschmid at the time. And I'm sure it must have been difficult for him to understand that the outside candidate got 85% of the support, he only got 15%. I think looking back over the following years, the Department of Surgery has really delivered in what was put into the department. The initial investment for retention and bringing in new faculty was about $12.5 million. And when we look back about 5 years after I came, the additional income that was generated by the hospital through physician fees without downstream affected to anesthesia, pathology, and so forth, was about $200 million. So you go from about 12 plus million to over 200 million in actual revenue. That is a major, major achievement. The same did not happen, obviously, in the Department of Medicine, neither under Dr. Goldschmid nor under his predecessor. And I think, that has been consciously or unconsciously a reason why there was right from the beginning just not a good chemistry. This all tremendously deteriorated just about a year ago when I was asked and invited by members of the Committee of 11 to talk about what they called ongoing issues and problems with the College of Medicine. So I met with these members of the Committee of 11 and I told them about my concerns regarding the College of Medicine, specifically the fact that our NIH ranking, the research ranking, had not improved a bit under the dean's leadership. We had lost outstanding faculty. We were not able to replace them. We were not able to take the college to a new level. And all this was important for a department of surgery that had become very strong through the recruitment of about 70 surgeons, many of them with a national reputation, and they needed partners. And the college was not able to basically accommodate the need for those qualified physicians that are not surgeons, and to build really a comprehensive and nationally reputed college after it had been achieved in the Department of Surgery. Now, these comments, very much on the professional side, were taken back to the dean, and just a few months after I had talked to the members of the Committee of 11, he asked me via Skype from his vacation home somewhere in Canada to step down as chairman of the Department of Surgery, citing a record of poor performance. Now, that made me stunned and shocked, because in all these years, despite that it's requested and required by the university, I had never gotten an annual review by the dean, nor anything in writing that stated that he was unhappy with my performance. On the contrary, I had a stellar, what they call a 7-year review. 7-year review is conducted by a group of outside peers, chairmen from other surgical departments in the country. We have brought people here from the Cleveland Clinic, from San Francisco, from Chicago, and they had given us high marks on how the department had improved, what had been achieved here. And then just a year ago, the internal review, the 5-year review, likewise came up with an excellent result. Very much in contrast to the Department of Medicine, which had received a poor performance score by the 7-year review committee. So I was very much surprised when I heard that he recorded a poor performance as the reason for me to step down. I think in the end it was the fact that I had made very public that the College of Medicine under his leadership had not been taken to a higher level. Nothing really had been achieved in the research, education, or in the clinical arena. A lot of frustration was going on, and he had created a climate of intimidation and fear amongst the faculty. Frequently, this unfortunate event here has been coined Gruessner versus Goldschmid. What people do not realize is that many of the medical faculty of the College of Medicine are supportive of my thoughts, my ideas, and my criticism, and are very afraid, obviously, to go public, because they then would be retaliated against, and it has happened to a number of other individuals. I just mentioned the former chairman of the Department of Anesthesiology, who also was interviewed by the Committee of 11, and just 2 months later was asked to step down.